Hi there, it's Cherylea from Anatomy for the People. In this video, I'm going to be talking about blood flow through the heart. So let's start with a drawing of the heart. Okay, so all the tissues in our body need a constant supply of oxygen. They use that for their metabolism. And once they've used up that oxygen, they're going to give off a waste product, which is carbon dioxide. So we want to bring oxygen into our body to supply our cells. They're constantly using it. We need to constantly supply them. And we want to remove carbon dioxide, this waste product, away from tissue cells and get it out of our body. So our heart is vital in allowing the movement of this oxygenated blood through our body and also moving deoxygenated blood throughout our body. And how does it do that? So let's have a look at the structure of the heart, and I'm going to talk about how blood moves through each of these parts. So firstly, you can see that the heart here has 4 chambers. So we have the atria at the top and the ventricles at the bottom. So each side of the heart is actually going to be dealing with one specific type of blood. So on the right-hand side of the heart, this is going to be responsible for dealing with oxygenated blood. So blood that is rich in oxygen. And then on the left-hand side of the heart, it's going to be dealing with deoxygenated blood. So blood that has low to no oxygen in it. It's never going to have no oxygen in it, because as blood moves through our entire system, we only use about 25% of the oxygen that's in it if we're at rest. However, if you are going to be exercising or increasing your tissue's need for oxygen, then we're going to be using a little bit of that. So when I refer to deoxygenated blood, it doesn't really mean that the blood doesn't have oxygen in it. It just has lower amounts of oxygen in it because our body has used a percentage of it. So let's start with the right atrium. So we'll start on the deoxygenated side. So here we have the right atrium, and so I'll use blue for deoxygenated blood. Entering into the right atrium, we have 3 sources of blood supply. And so that is going to be coming from the superior vena cava. The superior vena cava is a large vein that drains the head, so that would include your brain, it does the neck, it does your shoulders, so both of your upper limbs, so your hands, forearms, arms, shoulders, and a bit of the upper thorax, so your rib cage. So that's your superior vena cava, so that's bringing deoxygenated blood back to the heart. Then we also have blood entering into the right atrium via the inferior vena cava. And the inferior vena cava, again, is a really large vein, and this is going to be draining the blood from the rest of your body. So anything essentially below your heart. So that would be the rest of your thoracic cage, your abdomen, your pelvis, lower limb, all the way down to your toes. Then lastly, we have another blood supply draining into the right atrium. And this is just a small opening, and this is the opening for the coronary sinus. And the coronary sinus is actually draining blood that has served the heart tissue itself via the coronary circulation, so your coronary arteries. And I will talk about that in another video. Okay, so now what happens to the blood that has drained into the right atrium? So it's going to drain down into the right ventricle, which is here. And so that blood drains down here and it goes through a valve. And this valve is called the tricuspid valve. It is called tricuspid valve because it has 3 cusps. It is also known as the right atrioventricular valve because it's separating the atria and the ventricles on the right-hand side. So this is a unidirectional valve, meaning that blood can only pass down into the ventricle from the atria and blood can't go back up. Okay, so once the blood is down in the right ventricle, it's going to be moved to somewhere else. And it does that as the ventricles, as we have electrical messages moving through the muscular layer of the ventricles is going to contract, it's going to squeeze, and it's going to push the blood that's in here into somewhere else. So we know that we can't go back up the tricuspid valve, so it has to find another way. So it actually goes through a valve that's around about here. And this is your pulmonary semilunar valve. And again, a unidirectional valve that allows blood flow to only go in one direction. So this valve here leads up. If we go behind the heart, the blood is now going to enter into here. And so this is the pulmonary trunk. And the pulmonary trunk, pulmonary is to do with lungs. So this is the main artery that is going to go towards the lungs. Because obviously, if we have deoxygenated blood that has got carbon dioxide in it, we want to pump that blood up to the lungs and get rid of that carbon dioxide and pick up fresh oxygen. So we have that deoxygenated blood moving up through the pulmonary trunk, up, 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 and then goes off to the left pulmonary artery or to the right pulmonary artery. And so the left pulmonary artery goes to the left lung and the right pulmonary artery goes to the right. So then the carbon dioxide is moved to those lungs. It then leaves the blood, enters into the air of our lungs, and then we blow it out. And then as we breathe in fresh oxygen. So then that oxygen moves from the air in our lungs into our blood. And this exchange between carbon dioxide and oxygen at the level of air and blood within the lungs is a process called external respiration. So now we've got oxygen in our blood. So our blood is oxygenated. So that needs to come back to our heart. So now I'm going to change over to my pink pen to indicate oxygenated blood. So the oxygenated blood from the lungs is going to drain back to the heart and drain into the left atrium. We're going to have blood draining on the left side and on the right side. And so this would be the left pulmonary veins. We have our left pulmonary veins, and here we have the right pulmonary veins. So we have that oxygenated blood coming back to the heart. So just like how the blood from the right atrium moved into the right ventricle, the blood in the left atria is going to drain down into the left ventricle. So that blood is going to drain here through a valve, and that is the bicuspid valve. So bicuspid because it only has two cusps. It's also known as the left atrioventricular valve, again because it's between the atria and the ventricle on the left-hand side. And it is also known as the mitral valve. So those three names are all correct. It's just a different name. Okay, so the blood moves down into the left ventricle. And then when we have contraction of the muscular tissue within the ventricle, the blood is going to then move into an opening, which is here, which is the aortic semilunar valve. Because again, the blood can't go through this unidirectional valve, so it ends up going this way. And that's if we go behind, the blood is going to now end up in a structure called the aorta. And the aorta is the largest artery that we have in our body. It's going to arch around the back of the heart and go all the way through our thoracic cage and all the way through our abdomen. So it is the major blood supply that is going to feed into arteries and vessels that go throughout our whole body. So this is how we bring oxygenated blood to all of the tissues of our body. So pumping up that oxygenated blood that's come fresh from the lungs and pushing it through the aorta so it can be distributed throughout the whole body. Also, you need to keep in mind that even though I've spoken about the blood moving through the right-hand side and then coming back to the left-hand side, you need to remember that there is blood entering the heart at all times. So when the right atrium is filling up with deoxygenated blood, at the same time, the left atrium is also filling up with oxygenated blood. So as the blood moves into the atria, we're having the drainage of the blood down into the ventricles. When we have ventricular contraction, so contraction of the muscles in the ventricular walls, that's going to force blood to their respective location, so either into the aorta or to the pulmonary trunk. So that's happening at the same time. So as you're pumping blood to the body, you are also pumping blood to the lungs. Okay, I hope that you've enjoyed that video and that you've learned something today. See you next time. Bye.